The Victoria University of Technology Department of Nursing, in collaboration with two public primary schools in the western region of Melbourne, conducted a health fair in October and November 1993. The idea behind the fair day is to promote health, safety, hygiene and communication within primary schools. This is an activity organised by first-year degree students in the nursing subject at Footscray campus of the Victoria University of Technology, and it was organised to promote health and well-being in primary school students.
Nursing is basically about interacting with patients and with medicine and all that, but this is sort of different. You have to sort of get together and work, and it's sort of teamwork.
Is this better than sitting in a classroom looking at a blackboard?
Yes.
Yeah?
Much better.
Much better.
Because you can eat. Yeah.
And do you like the things that you're eating?
Yes.
The health fair was a one-day learning experience for primary school children, whereby the university students carried out 8 different teaching activities which are aimed to educate the children on healthy living habits. Marika, how did you become part of the program?
We were approached by the Victoria University of Technology. We were invited to express an interest in their project, to have that health fair, and when it was described to us, we thought, well, that really fits in with our curriculum, and it's not just something that's an extra or an add-on, it's really just reinforcing, as I said, some of the programs that we already have running in the school.
The fair's concentration on learning through participation and play was enthusiastically received by the children and made the day stimulating and rewarding for everyone involved. What do you think of this sort of program?
It's good. It's great.
Have you learnt things that you would not normally have learnt?
Yeah, we've learned a lot.
The main themes of the fair were nutrition, hygiene, safety and communication. The university's aim for the day's events was to facilitate the application of teaching and learning theory, a component of considerable importance in the curriculum of the student's degree. So how different is this from your normal course outline?
Extremely different. It was really great to actually be able to get out and do something with the children, to show them that we're not just nurses that go in hospitals, that we can actually teach other things as well.
Well, you've got to do a lot more things. You've got a group to work with, you have to be able to work with your group. You find that you have a lot of problems, but you've got to be able to get together and be able to solve them as a group so that everything goes really well on the day.
It gives a chance for the children to participate in all the activities, not just for the nutrition. There's also communication and health and safety, and it gives a chance for the kids to interact and actually hands-on learning.
The 8 different activities were carried out simultaneously while primary school children rotated through the different stations. Each activity was designed to capture the children's imagination and sense of humour while encouraging active learning through participation and self-reflection. All activities were moderated to suit the particular age group of the audience.
I'm dressed as a pumpkin, and our activity is for nutrition. We're going to be talking to the children about what nutrition is and the healthy diet pyramid and how they should eat foods from the various levels in certain proportions of the healthy diet pyramid, and how to apply this to everyday living.
Well, I'm involved with the maze, which is a safety activity, and I'm actually running a sun safety activity within that. And that's just teaching the children different dangers with the sun, sort of how to protect themselves from the sun using t-shirts and sunscreen lotion and everything, and then also how to apply sunscreen lotion correctly.
We found that if the kids were interested in what they were doing, they'd be more likely to participate, and if it was physical activity as well as questioning as well, that they'd become more involved, and it seemed to have worked today because the children seemed to really enjoy themselves.
One of the activities devised by nursing students was the Healthy Food Pyramid, where participants were asked to design their own nutritional food plan from foods on the Healthy Food Pyramid. In other activities, students were given the opportunity to create each other's lunches and drinks from a variety of healthy foods.
Well, it's been
great because it's allowed us to integrate the skills we've learned at university into a real life situation and take part and organise and cooperate with each other. So it's been really good.
And how much preparation have you gone through personally with this fair today?
Well, I mean, prior to this Friday, it's been a full week of doing last-minute constructions and setting up, but it's been a full semester's work planning.
The students of nursing also demonstrated the function of the digestive organs by constructing a huge gastrointestinal tract. In the communications area, a puppet show and a theme play were designed to illustrate how to handle a bully. How much preparation has gone into this particular show, into the puppet show?
A lot of preparation, a lot of time, a lot of money. It's been wonderful though, the outcome's been wonderful and it's all worthwhile, I think, yeah.
So how is this different from your normal methods of learning within the course?
Well, it's a lot better than just sitting there and learning in a lecture theatre. This way you're out, you're interacting with your peers and you're learning everything together. And you're working together, thereby you've also established that communication skills together too, you know.
So what's been the best part of the fair as far as you're concerned so far?
Seeing the kids smile after the actual activities have been completed.
Another communication activity gave the children an idea of what it would be like to have a sense impairment. An example of this was to actually act out being deaf or blind by placing blindfolds over each other.
Little bits of crunchy bits, like stuck in your teeth, and it tastes really sweet, and
Walk straight. Edward, just walk straight. No, don't make it.
In an emergency, how would you communicate? The children in this activity were taught how to communicate a message in an emergency situation. The theme of safety included a play illustrating fire safety and the stop, drop, roll procedure.
Stop, drop and roll. Stop, drop and roll.
Stop, look and listen. Let's say it all together.
stop, look and listen.
The use of seatbelts, road crossing behaviour and bike maintenance was the focus of the road safety section. This included a poster competition illustrating road safety. Ken, from your personal level, what have you gained from the activities here today?
My personal level, I've gained a lot of teaching experience, learning about children's behavior, and also I've learned today that this should happen all the time, that we can contribute a lot of our views for the young generation to come.
So you'd like to see this as an ongoing program?
It's an ongoing program and looking forward for another next year to come like that.
A maze activity was designed by the nursing students in order to encourage the learners to problem solve a variety of protective behaviours and hazardous situations. This proved very popular. What do you all think of today's activities?
Good.
Yeah, would you like to see these style of activities continue within the primary school system?
Yes!
Yeah. In the hygiene activities, storytelling and a puppet show illustrated the advantages of maintaining personal hygiene using soap and water.
Just before you eat, before you go to bed, after the toilet, after scratching your head, what you gonna do?
Wash your hands!
What do you actually think of the idea of the fair day?
I think I obviously looked at it firstly from the point of view of our students and their learning, and I think it's an excellent idea because it is. Nurses are increasingly going to have to be in the community and they're going to have to be health educators. There's much more emphasis on that. And I think this is an excellent way to find out what tremendous imagination the students have and how effectively they've organised it all. It's just superb.